Stem cell therapy, opioid epidemics, like there's a lot of things out there that are stoking up a lot of just, well, controversy and how we go about treating people when they're in pain, when they need to see an orthopedic doc to fix the problem. So I'm Dr. John Tate. I'm a non-surgical orthopedic doc, and today we're going to talk about some of these controversial biohacks that I use in my practice to help people naturally repair and regenerate their body. That's right, naturally repair and regenerate doesn't seem like, well, what's going on there? We need to know, but the default for our body, what you need to know is that is the default. 1 million cells a second, as we're chatting here and you're watching this, are turning over in our body and being replaced by other cells. The problem is we age, right? So as we age, this innate path mechanism our body has to heal, it's just not as good as it used to be. Okay, so this gets us over to pain management for some people. When they hurt, out come the meds, the NSAIDs, the opioids, and the other stuff. Now, on the other side of progressive treatment for this, we could lend itself to other things that mimic what that body's doing. So this isn't really a controversial biohack. It's what the body does to heal itself. That is the literal biology by which your body is hacking the healing cycle. And we'll talk about that healing cycle today. We'll talk about exactly how much time that takes. You'll understand why people go out on reserve injury reports saying things like 4 to 6 weeks, 6 to 8 weeks. Why? And we'll figure out, can you be superhuman and get back to what you love doing faster than a professional athlete? Well, we'll see about that. We'll also learn about the damp pain cycle. It's like, man, that damn pain, yes, there's a damp with a P pain cycle. We'll talk about that. And the last thing we'll dig into is a little bit versus our natural versus pharmaceutical interventions that you can use if you do have pain. So let's jump in, taking it high level at this slide. This is your body's built-in path to regenerate. Okay, there's a sequence of 4 very simple steps. When you get injured, the next thing that's triggered is your body gets inflamed. We've all felt that. That's the ache, the pain, the throb that shuts you down rightfully in the moment, and for a lot of people for a period of time afterwards. And so if we reach for anti-inflammatory pain relievers, that's what most people reach for. Why might that be problematic in the process? As you can see these steps, I intentionally left a gap between step 2 and 3. So if we're inflamed and we start squashing that inflammation, it actually slows down the rate at which we move on to regeneration and remodeling, or how completely that cellular machinery, your built-in pathway to heal, works. And I'll say that again, it will inhibit that pathway by which your body is designed to heal an injury, all for the sake of stemming off some inflammation and pain. So again, at the tail end, stay tuned. We'll talk about some of these natural compounds that I use in my patients that don't block this pathway, but they modulate it, because I don't want my patients to be in pain. What can we use that's natural for pain instead of those other things that could block this pathway? And then what can we use to accelerate regeneration and healing to get people over to complete healing? So in this slide over here, what we're looking at is a joint. Okay, at the high level, I want people to understand this watching the video. Your joint's comprised of some key structures. On the end of the bone, you have a cap of cartilage, and we want to preserve that at all costs, right? Because this is what gets whittled down over time, over age, and this is what leads some people, not everybody, because this is a myth that I'm going to bust today. Not everybody gets arthritis, not everybody gets severe arthritis, and not everybody as you age, if you're fortunate enough to live out far on the timeline, gets a joint replacement. Because I see 80, 84, 85-year-old patients in my practice that have mild arthritis. I also see 40-year-olds with severe arthritis. So we'll dig more into this as I produce a little bit more on this topic, because it's not linear with age. There are a lot of factors that go into how your joints age, and we're going to talk about some of those today. So also looking at this diagram, we can see there's ligaments. Ligaments support bones. They connect the bones together, so we need a ligament support system. You've all probably heard of an athlete tearing their ACL, which is a ligament internal inside the knee. It's not the end of the world. Typically lends itself to surgery, a long rehab process, and they can get back to being an athlete. But we can strain these ligaments too if we don't completely tear them, and that can give people a lot of pain. And the third thing that we can break down is muscle tendon. So muscle attaches to bone through a tendon. Tendons can be torn or strained, and those can be injured and cause a lot of pain. So we kind of see the structures on screen here of what could break down in a joint or what can get injured. And if we look deeper now at the structure of that, we're getting into that cartilage cap now. What is that cap comprised of? What structure breaks down? Okay, what structure do we need to think about in my process of building up or preserving? So we have that longevity in the joint. That's what we're gonna get into in a minute. So we can see these zones within it. And we start to shave down this superficial zone through mechanical friction, the quote unquote wear and tear. But there's also a chemical process I'm gonna get into because not many people talk about this. They talk about this as a simply age-related thing, a wear and tear thing, and there's a chemistry involved here that we need to appreciate because if we can alter that chemistry, redirect the body's ability to heal, we can shut off pain, we can slow down the rate at what one's joint is aging, and that is the complete ballgame, right? That is what we're targeting in regenerative orthopedics in my practice. So damp it, this really hurts. Look at this slide. Okay, so mechanistically, I want to keep this super high level. What it's showing in the middle of the screen, that stack of sphere, blue-shaped things, those are the cells. We call those chondrocytes. These are the cells that make cartilage. When we start to ding that superficial layer, we kick off these molecules called damps. Those damps trigger a reaction in the lining of your joint. And what we see looping back around are these things called cytokines and chemokines. We heard a lot about this back in COVID time where people were talking about cytokine storm. What does that mean? It just means a chemical inflammation that we saw in people's lungs and all over their body. But there's a chemical inflammation focally here in the joint that as this loops back around and forms these other things called MMPs, we start to get this chemical breakdown of that surface. And so there's this loop here we want to appreciate because if we can intercept that loop, turn off that vicious cycle, then hey, the body's able to self-repair. It has the tools to do that, 1 million cells a second. Every cell in that joint turns over approximately every 5 to 7 years. So it's how are we rebuilding that as people move along? Like that's the key to it. If you're aging, you're gonna age. Everybody's going to. But if we can slow down the aging of this joint, if we can break that cycle loop with things that are more natural and healthy, that's the mechanism I use for my patients. So let's dig one level deeper. This is super complex chemistry, but it's showing us on this slide where these intercept points are. Meaning, if we want to stem off and interrupt this cartilage loss that's going to happen, how do we protect and preserve what's there? So you see a component on screen called hyaluron. That's hyaluronic acid, or back in the day they called them rooster comb shots. These gel derivatives now that we can put in one's joint that can reintroduce a lubrication aspect to the joint. We think it also helps with the elasticity of the cartilage, but it's not in itself regenerative. Think of it as somewhat protective. And it can shut off some of that negative chemistry, so this can be way more beneficial than things like steroids, which I've already spoke about in a few prior video, where steroids can be pretty detrimental to the health of the joint if we continue to pour them in there. So hyalurons came along on the scene, and those started to be used as something that's probably more beneficial than something like steroids from the 1960s. So think about hyalurons coming on the scene, 1980s, 1990s, they're still around, but unfortunately some of these are getting whittled down by insurance plans, so depending on your insurance, this may be covered, may not be. But it's still a decent intervention to use to shut off that inflammation, maybe protect some of the cartilage that's in there. If we bump this along and we look at now collectively what's going on in the body, right? There's this multi-input problem for the cells inside that joint. Okay, we're aging. Maybe there was trauma to the joint that got you injured in the first place. Maybe there is, of course, wear and tear if you like to move and you're an athlete. And then we have pain and inflammation. We have all these other pathways feeding back to this cell, stoking this inflammation that's grinding this thing down faster. So on this slide, if we can look at that and see, okay, these are the pathways we can intercept, as I talk about with my patients. Some of this, we don't need fancy treatments. We just need to change one's nutrition. We need to take their diet from really quite inflammatory to something that's less inflammatory, because that's going to have a systemic effect on the body and how the joint's able to heal. And that's a good place to start, is just foundational nutrition. Another thing I teach my patient on this side is just daily practices to become what I call ageless. Now, okay, we're making a little joke there, but if we don't do simple practices like these or some of these, like this is scientifically backed to help us. First, starting with your mindset, really about why you want to get better, what's next, and kind of why does it even matter. Sleep is probably the cheapest regenerative medicine therapy on the planet, but most people don't get enough, or they don't get it consistently, and they're not conscious about planning better sleep. And so I'll detail that out in a future video about how can you hack your sleep to get deep restorative sleep, because that is where your body goes to work repairing itself. So if we're not getting deep restorative sleep, you're not repairing. Bottom line, your battery is somewhat half charged the next time you get up, and you continue to grind it down the next day. So how do we have more happen when you're sleeping to regenerate and repair? Gratitude practice. Let's talk about that for a minute. So being grateful, maybe that's the only joint you hurt, not every joint in your body. But no, all jokes aside, like a gratitude practice, thinking about things you're grateful for, is scientifically backed to actually help your body feel better and heal faster. If we're always stuck in the negative loop, right, which a lot of patients that see me are, and they have a hard time finding anything out there that they're grateful for, appreciative of, it becomes its own kind of systemic grind on the body. Okay, so think about that a little bit. And then simple things, hydration. Most people are underhydrated. Our body needs hydration to function at its best. Movement, we need to have quality movement, obviously hard when somebody's injured. So this is where you have people working with a physical therapist or a trainer, somebody to move them along through that process. Whole food nutrition, we're going to talk a little bit about this. We'll deep dive on that another day. But 80% of the time you should be getting high quality nutrition in your body, right? I don't live like a monk. I eat things on the weekend, maybe here and there, have a meal out, not fret about it. But what is that whole food nutrition you're looking at to help your body heal? And think of it as that. What's nourishing and helpful versus not so much and hindering maybe to the healing process. Breath work. So taking breath into your body is something people forget how to do. We do it automatically, but we don't do it restoratively, where we can actually turn on how your body heals itself by putting it more into this parasympathetic side of the body where it's designed to heal. So this is a great book by James Nestor. I recommend you read it. Simple box breathing, like I illustrate on this slide, helps people flip things over to that parasympathetic side of the body. And this is where our body, again, is in that reparative, regenerative, restorative, versus this really tight, anxious, kind of sympathetic, stressed out position. So that's going to get people into that area where they can actually heal. Gratitude, ultimate longevity multiplier. So you can see on this slide so many things that impact the health of our body, from our immune system to the state of our brain, cognitive function. So I highly recommend you adopt some type of gratitude practice in the morning. Only needs to take a minute. What's one thing you're grateful for? What's one person you're grateful for? What's one opportunity that you're able to go pursue today that you're grateful for? That simple and done. And I wrote a lot about this. I wrote a book in 2012 about this concept of nutrition. There's a URL up on this slide. If you want a digital copy, go there, download it, check it out. But what I walk people through in that is this system by which our body is able to heal if we have it in a less inflammatory state. And we have it in a more inflammatory state, it's just not able to do it as effectively. It's not talking about a ton of supplements in there, it's talking about whole food nutrition. But if we move over to supplements for a minute, these are some things I talk about with my patients, that if we're trying to replace things like NSAID medications, anti-inflammatories like ibuprofen or naproxen, this is where we can use natural things like curcumin or turmeric root. We can use CBD or CBG compounds. We can use fish oil and its metabolites, which again, most of us don't get enough omega-3s in our world anyways if we're not eating fish 4 to 5 times a week, and we need that. It's called an essential fatty acid for a reason. But it can also help with inflammation, it can help tune down pain, and it's really good stuff that your body needs for all the other cellular repair that's going on daily, outside of just what's happening in a joint that I may be focused on. So there's a lot of natural anti-inflammatories, and I stack these both internal, meaning oral supplements, and topicals. So a lot of these compounds like arnica, boswellia, CBD can use topically on the area. And we bypass this whole circle of side effects that we can get from ingesting oral things, because even some supplements of a high quality may not compute with somebody's digestive system, and they may get some stomach upset or otherwise. So again, we can use topical agents on an area, and those can work quite effectively. Natural pain modulators and joint builders. Hey, at Origin, we've worked with some good companies to focus on what are these key components, as you learned in this video, that are breaking down in the joint. what kind of nutrition can we give the body back daily? So think about it like a multivitamin for your joints. Things like collagen over the past 5 to 10 years have shown a lot more promise. Do we have empirical data for 20 years? We don't, but many patients that take this stuff feel better, right? When we deplete collagen in our body, we become less elastic, less flexible, we injure things easier. So collagen's a big thing. Glucosamine, chondroitin, these things have been around for decades, but just like anything else, they've gotten better over time. So we can think about these as a multivitamin for the joint. And then, using a natural pain reliever or a tool to knock down inflammation, that's really the trifecta that we talk about with patients to help them on the front end with pain and something for the daily, for the long term that could benefit their joints significantly. So, in wrapping up today, what we want to think about are, okay, over here, natural anti-inflammatories, good idea. NSAID medications work, but not quite as effective. Okay, if we move into treatments, we want to think about, hey, these things that are done conventionally, like cortisone injections, they come with a risk. Can we push people over here with a different mechanism to help that joint heal and self-repair? That's platelet stem cell therapy, some things that I'm going to get into deeper in a future video. But all of those things are available for people now to look at, right? These aren't things that are coming soon or not proven or experimental. These treatments have been around for decades, and most people aren't aware of those. So hopefully this video brought forward a little bit of awareness on these treatments, maybe some alternatives that you can use outside of those NSAIDs, something that can help you better with inflammation and pain. And so if this helped you in any way, click the like button below. If you have any comments about this and have a question, we'll answer as many questions as we can in the comments, my team or I. And if we can help you in any way, look at the notes below. There's a link there that you can click over and do a discovery call with somebody in my group to see if these treatments, things we do, could help the situation you find yourself in today.